Late spring 1945, the blistering sun scorched the earth of a temporary P facility in northern Germany. Dust, despair, and the sharp scent of hurried construction hung heavy. Among the barracks and barbed wire, a scandalous act was about to unfold. An act that would force soldiers to confront duty, empathy, and the fragile line between military protocol and human decency. Before continuing, remember we post stories like this daily, so subscribe to never miss one. Now back to the story and its events. Sergeant Major Arthur Davies was a veteran of the North African and European campaigns. At 32, his shoulders carried years of war from El Alamein to the Rhineland. Beneath discipline and steel lived a belief in fairness taught by his father. The war's final months brought Germany's surrender and the detention of countless German personnel. Under-resourced P camps emerged rapidly. Food and water were rationed, communication was strained, and the occupying British forces operated under relentless pressure daily. Davies patrolled the section holding female auxiliaries and captured nurses. Many had served as clerks, medics, or signal operators. Regardless of allegiance, they were swept into captivity. Though the Geneva Convention applied, chaos often eroded humane standards. Elsa Richter sat on a thin cot inside a stifling barrack. At 26, she had been a signals auxiliary until surrender. Pain burned through her lower back and side. From training, she feared a kidney obstruction that could soon become fatal. Unable to clearly explain her condition, Elsa faced a language barrier. Guards spoke little German, and her English was fragmented. Each hour increased the danger. Without urgent medical help, infection and kidney failure loomed, threatening her life in silence. Private Thomas Allen, barely 20, had recently been reassigned to guard duty. A former driver, he carried a sketch pad and quietly documented camp life. He believed the truth of war's end lived in the faces of the defeated and forgotten. Major Alistair Finch, the camp's medical officer, had been a general practitioner in Glasgow. Now he worked amid shortages, forced to make brutal choices daily. He prioritized the gravely wounded, carrying the heavy ethical burden of wartime medicine. Colonel Hugh Macmillan commanded the camp with rigid discipline. His view of the Geneva Convention was minimal compliance only. Sympathy toward prisoners felt like betrayal to fallen British soldiers. Protocol, order, and emotional distance defined his leadership philosophy. Sister Margaret Alley was among the few British women serving in field conditions. At 35, she combined surgical skill with rare empathy. Years of treating wounded civilians and prisoners gave her a working German and a habit of seeing people first. During a morning welfare check, Alley noticed Elsa slumped and sweating despite the cool air. Kneeling beside her, Alley spoke softly in German. Elsa whispered "kidney" and pointed to her flank. Ali instantly recognized the signs of a renal crisis. If a stone blocked the ureter, infection could escalate into fatal sepsis within days. Ali hurried to Major Finch, explaining the symptoms. Finch's concern was immediate, but so were the limits. They lacked imaging tools, sterile theaters, and spare supplies. Despite shortages and regulations, Finch knew delay could be deadly. Bound by his oath, he gathered his medical kit and followed Ali. He examined Elsa carefully. When pressure caused sharp cries and muscle rigidity, the diagnosis became grimly clear. Finch checked his watch. They had perhaps 24 hours before infection overwhelmed her body. Immediate stabilization was critical, yet a practical obstacle remained. Elsa's thick wool uniform was tightly laced, restricting access to her abdomen and lower back. Asking her to undress would take time she didn't have, especially with pain and language barriers. Finch made a hard decision. The dress would need to be cut away for examination and possible emergency treatment. The order carried serious moral weight. Finch needed a reliable NCO to execute the task without hesitation. He sent Ali to find Sergeant Major Davies. When Ali explained the situation, Davies felt unease. This was no combat action, but an intimate, culturally charged intervention on a prisoner. Davies remembered his father's words about respect for all men. Yet war had taught him that mercy sometimes required disturbing actions. Elsa lay nearly incoherent with pain as approval was secured from Colonel Macmillan, who demanded strict documentation and witnesses. Private Allen was ordered to photograph the procedure as protection against future accusations. His hands steadied despite discomfort. Finch gestured to Elsa, explaining as best he could. Though terrified, she understood the urgency and gave a faint nod of consent. Davies positioned himself beside the cot. At Finch's command, he tore the heavy wool dress along the seam. The ripping sound echoed sharply. Nearby prisoners cried out in alarm as guards formed a perimeter, believing they were witnessing cruelty. With the fabric torn aside, Elsa's swollen flank was exposed. Finch immediately palpated the area, confirming severe inflammation. His suspicion was validated. A dangerous obstruction and spreading infection threatened her life without immediate aggressive intervention. Finch nodded sharply to Davies. The necessity was clear. Allen's photograph captured the moment, shocking without context, but grounded in medical urgency. There was no malice, only the desperate race against time to prevent a needless death. Elsa was placed on a stretcher and rushed to the medical tent. Ali prepared the cramped space while Finch scrubbed with scarce antiseptic. Davies and Allen secured the perimeter as Colonel Macmillan watched silently from the entrance. Even Macmillan understood that allowing a death through inaction would leave a permanent stain. Resources were limited, but conscience demanded movement. Inside the tent, the atmosphere was tense, heavy with responsibility and the risk of irreversible failure. The procedure lasted 2 harrowing hours. Finch administered antibiotics and pain relief, attempting non-surgical relief of the blockage. The stone partially passed. Infection remained severe, but they had intervened just in time to stabilize her condition. Davies waited outside with Allen, neither speaking. The sound of tearing cloth replayed in Davies' mind. He hoped history would remember this moment not as a violation, but as an act driven solely by the will to save a life. When Finch emerged, exhausted but composed, he confirmed Elsa would survive with continued care. He shook Davies's hand in quiet acknowledgement. Both men knew they had bent protocol, risking scrutiny to preserve a single human life. Allen documented everything: reports, images, and witness statements. One photograph alone looked damning. Together the evidence told a fuller truth. Medical necessity, urgency, and restraint replaced any narrative of abuse or cruelty. As Elsa slowly recovered, Allen recorded testimonies to preserve accuracy. The German prisoners, once horrified, began to understand. Elsa herself explained that the action saved her life, and that necessity, not brutality, guided the soldiers. Sister Ali visited Elsa daily. Through broken language, a bond formed. Elsa spoke of her dreams of teaching. Ali shared her belief that healing must transcend uniforms. Humanity, briefly eclipsed by war, quietly reasserted itself. 3 weeks later, Elsa could walk unaided. She requested to meet Sergeant Major Davies using an interpreter. Davies resisted praise, insisting he had only followed orders, yet agreed to the meeting out of respect for her wishes. Inside the quiet medical tent, Elsa thanked Davies deeply. She explained she understood the difficult choice he faced and believed his actions showed moral courage. Davies redirected credit to Finch, but Elsa insisted deliberate care had guided his hands. Colonel Macmillan observed the exchange from a distance. The moment unsettled him. His rigid belief in protocol had never allowed room for gratitude from the enemy. Watching them, he questioned whether rules alone could ever define what was right. As repatriation began, Elsa prepared for release. The scar on her flank remained hidden but permanent. It marked suffering, survival, and an unexpected mercy that forever altered her view of former enemies and the war itself. Before leaving, Elsa gave Sister Ali a small carved wooden bird she had protected throughout captivity. Ali accepted it with emotion, promising to remember her and to keep treating the sick as patients, not uniforms or nationalities. Allen submitted his full report to military records. Classified and archived, it vanished among countless documents. Yet the truth remained preserved, waiting decades for rediscovery by those willing to look beyond surface images. Davies returned to railway work in Manchester. Like many veterans, he rarely spoke of the war, but sometimes he recalled the tearing sound and a young woman's life balanced on seconds, believing he had done something quietly right. Decades passed, former enemies became partners. In 1985, a historian uncovered Allen's report in the National Archives. The photograph and detailed records demanded attention, revealing a complex story buried beneath official silence. She traced everyone involved. Finch was a respected surgeon. Ali ran a hospice. Macmillan lived in reflective retirement. Allen became a photojournalist. Davies neared retirement. Elsa, now married, taught in Berlin, shaping young minds. The historian arranged a reunion. After 40 years, Davies and Elsa met again. Time had changed them, but recognition was immediate. Words once impossible flowed freely, completing a conversation interrupted by war and necessity. Through an interpreter, Elsa told Davies how that single act of care shaped her life. It gave her strength to teach forgiveness and resilience. Davies, still modest, said only that he was relieved she had lived a full, meaningful life. The documentary captured their reunion's quiet power. Awkwardness gave way to shared history. Viewers saw not enemies but two people bound by one irreversible moment where compassion overcame fear and protocol. When released, the film challenged simple wartime narratives. Soldiers and prisoners appeared as complex individuals. The image of the torn dress transformed from scandal into a symbol of medical duty beyond national boundaries. The story raised difficult questions. How many similar emergencies went untreated in P camps due to shortages or reluctance to aid the enemy? Elsa's survival stood out precisely because so many factors aligned to save her. Historians noted that Finch's bold judgment, Macmillan's reluctant approval, Ali's advocacy, and Davies's decisive action each mattered. Without any one of them, the outcome would have been fatal. Individual choices proved decisive. Cultural meaning was also examined. The violent tearing of the dress carried deep symbolic weight in German society. That Elsa could forgive it, understanding its necessity, revealed remarkable strength and moral clarity. Finch spoke of wartime medicine's ethical tightrope. Every decision weighed limited supplies against human need. The documentary forced him to confront questions he had carried silently for decades. Sister Ali argued that medicine loses meaning if it is not universal. The moment a caregiver values one life over another by nationality, the profession itself is betrayed. Her response to Elsa's suffering had been instinctive. Macmillan admitted his strict minimalism had been moral evasion. Approving the procedure protected regulations, not conscience. Watching the aftermath taught him that mercy must sometimes exceed what rules merely allow. Allen explained that his documentation began as protection against accusations. Over time, it became proof that humanity could survive even inside systems designed for control, scarcity, and dehumanization. The documentary concluded with a final reunion in London in 1986. Davies and Elsa sat at the center, surrounded by those who shared that moment. Stories flowed, acknowledging how one decision had bound their lives forever. Elsa spoke of teaching her students to see people before nationalities. Davies admitted he often wondered if she had survived, hoping his action had meaning. Hearing her story finally gave him quiet peace. The film was widely broadcast. The once damning photograph became a case study in medical ethics, moral courage, and restraint. Context transformed shock into understanding and suspicion into respect. Families of those involved learned the full story. Davies's children understood his silence. Elsa's children learned their mother lived because strangers chose compassion over indifference at a critical moment. Ethicists continue to study the case as moral decision-making under extreme pressure. Historians view it as a window into the human complexity of post-war camps, where rigid systems collided with conscience. At its core, the reason Davies tore the dress was simple. A life was slipping away. There was no cruelty or agenda, only limited time, scarce tools, and the human choice to act decisively. In a war defined by mass death, this moment stood apart. It was intentional compassion amid intentional violence, proving that even within brutal systems, individuals could still choose mercy. Elsa's descendants include teachers and aid workers shaped by her story. Davies's family supports medical charities, honoring his legacy by extending the same difficult compassion beyond borders. History remembers wars through battles and treaties, yet it is built from small decisions. Each choice determines whether humanity survives conflict or becomes another casualty of it. The torn dress became a symbol of healing, not violation. A reminder that even in war's darkest hours, people can still choose life, dignity, and shared humanity over hatred.